Vaccination is the best, convenient, and easiest way to prevent infections. A lot been said about childhood vaccination. So let's talk about adult vaccination. You as an adult need to keep your vaccination status up to date. I am Dr. Nadeem Sajjad Raja. Adults, no doubt, are at risk of infection because their immunity acquired during childhood due to childhood vaccination is weaned off with the passage of time. You as an adult need boosters to boost your immunity. Why do we need or why we should get ourselves vaccinated? Number one, vaccines have saved lives over 100 years, though serious diseases are still a threat. Number two, vaccines are the best way to protect people from preventable diseases. Specific vaccines help to create antibodies against specific disease, also help to prevent the spread of disease or infection to other people. Some people cannot get a vaccination due to allergy or some other reasons or allergic to some contents in the vaccine. If good number of people in the community are vaccinated, then unvaccinated are less likely to acquire the infection. Number three, vaccines can prevent serious illness. Some vaccines prevent serious illness or complication. For example, influenza, hepatitis B virus, human papilloma virus. Number four, the vaccines you receive are safe. Vaccine safety is a paramount priority. Some people can have side effects such as fever, swelling, body aches, tiredness. Number five, vaccines may be required to healthcare workers, army recruits, school children, because they are at risk of catching and spreading the infections. Recommended vaccines for adults. Everyone should make sure that they are up to date with flu vaccine, COVID vaccine, tetanus, diphtheria, whooping cough vaccines. You may need other vaccines too, according to your age. For example, chickenpox, hepatitis B virus, human papilloma virus, meningitis vaccine, measles, mumps, rubella vaccine, COVID vaccine, shingles, pneumococcal vaccine. You will also need vaccine to prevent infections in certain health conditions. For example, people with no spleen, pregnancy, heart disease, stroke, liver, kidney diseases, lung diseases, HIV. There is one very important question: who should not get the vaccine? For example, who had suffered with adverse reaction or allergic to any content in the vaccine. Live vaccines in certain health conditions can't be given. Please consult with your general practitioner for advice. Thank you for watching this video.